Surgery and type 1 diabetes. There's so much anxiety and worry when these two worlds collide, but I'm going to help you get through it. So I'm an anesthesia provider and my daughter also has type 1 diabetes. And someone sent in a question saying, I'm having surgery next Friday and I don't know if my endocrinologist wants me to remove my pump. What I would recommend you do as an anesthesia provider who has taken care of many people with type 1 diabetes during surgery, I would recommend that you keep your pump on. And I also recommend that you change the site of your pump the day before your surgery so that you have nice, fresh site that's responsive to insulin. Just make sure you put your pump site somewhere that is not going to interfere with the surgical site. Otherwise, they may have to remove it, and you just don't want to deal with that. So just make sure it's in a safe spot to begin with. If you use the Omnipod or the Tandem and you're running on the algorithm, I would recommend that you just keep those algorithms running and let the surgical staff know that that's what you want to do. It's going to adjust your basal rate during surgery, and it might give you an autocorrection dose during surgery. And as the anesthesia provider, I'm going to let the pump algorithm do most of the driving, but I also have insulin with me and I also have sugar with me, so I can intervene whenever I need to keep you safe. If I need to give you extra insulin because your sugar's really going crazy, I'll probably just give you a tiny little shot in your shoulder or something. And I've done that several times and it brings you down nice and easy. I'm very conservative with insulin administration during surgery. I don't want your sugar moving quickly at all. I want a nice, slow movement taking place. But I promise you, the algorithm that your pump runs on is going to do a better job managing your blood sugar during surgery than the average anesthesia provider. Now, that is my recommendation as an anesthesia provider. If your endocrinologist feels differently given your specific circumstances, then absolutely do what they want you to do. This is just me from behind the surgical drapes giving you what I would recommend from an anesthesia perspective. And when it comes to your sensor, do the same thing. Make sure your sensor is working well. If it's not working well, change it at least a day before so it has that time to soak and get acclimated and have a nice smooth tracing. Put your sensor somewhere where it's not going to interfere with the surgical site as well, and put it somewhere where you're not going to be compressing it during surgery. That is important, so you don't just have a bunch of gnarly compression lows going on. Remember, most people during surgery are laying in the supine position, laying on your back, and your arms are going to be outstretched like that on the arm board. So keep that in mind when you're placing your sensor. I say that because putting it directly on the back of your arm, where a lot of people do, it might actually get compressed when your arm is laying on the arm board of the surgical table. So a great alternative might be your abdomen, or the front of your thigh would be a great spot as long as it's away from the surgical site. I would also recommend that you give the anesthesia provider access to your phone. Unlock it, make sure that it's fully charged, and that way they can just prop it up against their anesthesia machine and just keep the G7 app open, the G6 app open, the Libre app, whatever you use, and they can just have your tracing in front of them at all times. That's going to be helpful for them so they can see the movement of your blood sugar. They are also going to poke your finger to verify the accuracy of your sensor, that it is reading accurately. If you have type 1 diabetes and you have other questions about the surgical process, let me know what they are. I'll do my best to answer them. Remember, this is not medical advice. This is just educational content to help you prepare for such a situation.